I once met a man, probably in his 50s, and he was at the restaurant I worked at the time. This man seemed to be shaking uncontrollably at the hands, and when I brought his food out to him, he asked me one simple task that many of us take for granted. He just asked me to put ketchup in his bag. As I did this small task for him, he began to tell me about how he had rheumatoid arthritis. I then explained to him that I also had RA, but he was surprised and he interrupted me. He asked me how old I was. But that's the common misconception. Anyone, even you, can be affected by any form of arthritis at any age and at any time. I'm able to present this information to you because I have thoroughly researched this and I also have lived with RA for 20 years of my life. The purpose of the speech is to give you information about the disease that I think everyone should be aware of, even if you think you're not at risk. Arthritis is a chronic autoimmune disease that causes inflammations in the joints. And today I would like to talk to you about who all can be affected by rheumatoid arthritis, the symptoms of arthritis, and treatment if you ever are affected by arthritis. According to rheumatoidarthritis.org, middle-aged people are affected the most by rheumatoid arthritis, and 3 times as many women are diagnosed with the disease over men. Although the disease normally doesn't occur in children, juvenile rheumatoid arthritis can affect children at any age. Moving on to the symptoms of arthritis, it can start off slow and progressive. Sometimes the symptoms can be hard to detect and they're also non-specific. They can differ in severity and frequency depending on the person. The main common symptoms are swelling in the joints, stiffness in the joints, intense pain and damage to the joints, and redness when the joints are inflamed. The physical symptoms can also include loss of appetite, fatigue, muscle aches, and weight loss. Finally, treatment of arthritis can vary. As far as medication, doctors don't know what causes arthritis, so it can be a trial and error process, trying to figure out what works and what doesn't, according to the patient, of course. Natural treatment that can help can include long warm baths, proper diet, and plenty of exercise. The most important thing for people with the disease is to not stop moving, continue to exercise, and keep those joints warm. In conclusion, I would like to remind you that the purpose of the speech is to inform you about important information about rheumatoid arthritis. I have informed you about the symptoms of RA, who can be affected, and also treatments of the autoimmune disease. If you feel any of these symptoms I've talked about, please go see a doctor. Anyone can be affected at any age. Know that genetics does not play a major role in the diagnosis of arthritis, and if affected by arthritis and it goes untreated, your joints can go through permanent and irreversible damage.